Douglas Robinson, Campbell Podiatry. When you become a podiatrist, one of the goals for most of us is to be foot and ankle surgeons, and it takes an arduous process to become educated and proficient with doing surgery, and most surgeries work out great, but not all of them do. 85% success or better when you have surgery. Most people who have surgery pursue that because nothing seems to make things better until they have surgery, but then sometimes the surgery doesn't work out. 40 years ago, this person had bilateral, meaning both feet, bunionectomies and some of her toes corrected, and it didn't work out in her favor. This is a complication called the hallux varus. So instead of she doesn't have a bunion that's come back, but you see how the toe's leaning and it's pulling these in? So this is called hallux varus. This is a recurrent bunion. The bump is there. You see how this is leaning again, and then this toe is trying to get out of the way because these two are having a relationship, her big toe and her third toe. So this is an area of pain. What bothered this person the most was this toe. So rather than putting her through surgery, she's older, really active, doesn't want to take time to go through the recovery, and also there's some risk it wouldn't work out. I recommended, as the shoe police, get some new shoes, go to a place that I really trust. They're going to measure you. They're going to get you into a more voluminous shoe. So she wore a size 10. She's still wearing a 10, but she's now wearing a Brooks. Instead of a 10 standard width, it's a 10 quad E, so 4 E's. So before, when she was wearing shoes, it was crowding her foot. When you stand, the foot spreads, so it was just putting pressure, and this little guy here was very unhappy. It was crying. Now that she's got the size 10 quad, she's totally happy. Despite these not looking well, they don't hurt. So I made this recommendation so she doesn't have to go through surgery again. She's got more voluminous footwear. She can exercise. She's not hurting at all. And I call that success. Although it doesn't look great, it doesn't bother her, the cosmetic aspect. And I wouldn't go through this from a cosmetic standpoint. When you're in your 80s, people aren't looking. They're looking at your smile more than your feet. So I feel I gave her legendary service because, number one, she didn't need more surgery. And two, she's very happy because she's not in pain anymore. And this is how we take care of it, how we approach everyone who has a foot and ankle condition. I'm Dr. Douglas Robinson. I hope this helps to point you in the right direction. Please take care of yourself and each other.